for Great Plains Tribal Chairman's Health Board since December of 2015. Prior to joining the Health Board, she obtained her master's degree in public health with the emphasis in population health for the University of North Dakota in May of 2015. Kendra works as a health educator and PSE specialist for the Northern Plains Comprehensive Cancer Control Program. The Northern Plains Comprehensive Cancer Control Program promotes screening and prevention initiatives to reduce the burden of cancer among the Great Plains tribes. And with that, I would turn it over to Kendra, but also keep in mind that we will be sending out surveys, survey feedback forms. So if you get a chance, please click on the link. We'll be sending that out here shortly. And then afterwards, you can fill that out and we'll get that from you. Go ahead, Kendra.
Okay. I just hit share screen, right? Oh, yep.
Yes, whenever you're ready.
All right. Oh man, I can't get. All right, as Eugene said, my name is Kendra Rowland. I am the health educator / PSE specialist for the Northern Plains Comprehensive Cancer Control Program. And today I am going to talk to you about policy systems and environmental approaches to cancer control. So just a little background about our program. The Northern Plains Comprehensive Cancer Control Program is funded through the CDC. The CDC funds 50 states, 6 U.S. territories, and 7 tribal organizations with seed money to develop and implement cancer control plans. Cancer control, comprehensive cancer control is unique and a little bit different than a typical program because it's a process, and our comprehensive cancer control programs are provided with a small amount of funding to support a small amount of staff, and we facilitate and organize the process, which includes building partnerships, creating a cancer plan, and then working with those partners to implement the plan. Right here, we just have a list of the other tribal communities that have the Comprehensive Cancer Control Grant through the CDC. So again, the Northern Plains Comprehensive Cancer Control Program, our goal is to work with tribal leaders, community members, and stakeholders to reduce the burden of cancer in the Great Plains area. As we know, the Great Plains American Indian population has some of the highest rates of cancer incidence and mortality compared to both other native and non-native populations across the country. So just a little cancer basics before we get started. Cancer is a term used for diseases in which the DNA of a cell will become damaged or changed, and this creates mutations, which in turn leads to uncontrolled cell growth. This is how we get tumors and such. And there are more than 100 different types of cancers. These cancers are named for the organ in which they originate and the type of cell in which they start. So here I have a table of the most common cancers among Great Plains American Indians. And as you can see, the second and third most common cancers in both men and women is lung cancer, followed by colon or rectum cancer. Those that are highlighted in red signify that the Great Plains American Indians have a higher rate of that cancer compared to whites within the region. As you can see, for women, the #1 most common cancer in the region is breast cancer, and for men it is prostate cancer. So what does the data that we have tell us? American Indians and Alaska Natives in the Northern Plains experience the greatest cancer burden, a far greater cancer burden than any other population within the region and other American Indian Alaska Natives in the United States. Within Nebraska, North Dakota, and South Dakota, lung cancer is actually the most common type of cancer fatality among American Indian Alaska Natives. So I just want to go over a couple risk factors. We have commercial tobacco use, poor diet, being overweight, a lack of physical activity, certain viruses or bacterias, alcohol use, sunlight, chronic exposure to environmental hazards, and genetic predisposition. So a person's cancer risk can be reduced with healthy choices such as avoiding tobacco use, limiting your alcohol use, protecting your skin when you're in the sun, avoiding indoor tanning such as the use of tanning beds or UV light. And another thing to note is that it's the number of new cases of cancer can be reduced, and we can reduce the amount of cancer deaths. Cancer is preventable. So, given the minimum resources, how can our tribes maximize healthy communities and cancer prevention efforts? We can do this by shifting the focus from changing an individual's behavior to focusing on the infrastructure of a community so that that community can support a healthy behavior choice. This in turn will extend the impact of public health interventions by changing policies, systems, and environments to reach more people, prevent cancer and disease, and create long-term changes within our communities. So what exactly is PSE change? Policy, systems, and environmental change refers to a public health intervention that aims to modify an individual's environment by removing the risk factor from that environment. By doing this, it makes the default option or choice for that individual a healthy one. So, PSE aligns with many of our Great Plains tribes' cultural beliefs by creating systems that provide healthy habits and knowledge for our future generations. These processes address the sacred hoop of life and the interdependent relationships of our tribal environments. Everything is related, and the ancestors of our Great Plains tribes had a multifaceted approach to tribal well-being and survival. By understanding their environment and the role in it, our ancestors were able to maintain good health for the community as a whole. So PSE change allows our tribal leaders to continue these traditions in today's society by encouraging healthy and sustainable behaviors, lifestyles, and environments that can strengthen the foundation and health for our tribal members and their descendants. So just a little breakdown of PSE, policy, systems, and environments. Policy refers to laws, regulations, or rules. Systems are the processes or rules of an organization, institution, or system. So this could be a hospital, a school, things like that. And then environment just refers to our economic, social, or physical environment. So here I have just a little breakdown again and some examples. So policy and interventions, an example would be adapting workplace policies that promote a culture of good health. A systems intervention is a change that impacts all elements of a tribe or tribal organization or community. So an example of this would be the implementation of a provider or client reminder intervention system within IHS or within any tribal health programs. And then an environmental intervention could be physical or material changes to the economic, social, or physical environment. And an example of this could be designing a work site that encourages good health. So whether that be getting rid of vending machines with non-healthy options or choices in them and putting only healthy options in them. Another example would be having a worksite policy in which you can devote 30 minutes of your time to getting physical activity, going for walks, having standing desks, things like that. So how do we use policy systems and environmental change within the cancer realm? we can do this with primary prevention, early detection, or treatment and survivorship. So primary prevention efforts are ways that we would use so that cancer never develops. This could include health counseling or health education. And in terms of early detection, research shows that doing the screening, following screening guidelines and recommendations does help prevent disease, and you do find your cancers at earlier stages, thus having a longer life or saving a life. So now I just want to go over examples of primary prevention, early detection, and treatment and survivorship. And I broke those down by policy, systems, and environmental changes. So an example of a policy change in regards to primary prevention of cancer would be that we could adopt tribal policies that restrict the sale, advertising, and promotion of tobacco products. In terms of a system approach, we could adopt policies within our IHS facilities that would provide inpatient counseling and treatment for patients that use tobacco. In terms of an environmental approach, we could adopt policies that prohibit smoking of tobacco products in various areas on tribal land or reservations, such as housing facilities, daycares, schools, IHS buildings, things like that. So another example of some primary prevention changes that we could use, a systems example would be to promote or integrate the use of a sun safety educational curriculum within middle schools or elementary schools. And also we could implement programs to promote access healthy to foods. We saw earlier that one of the risk factors was poor diet or being overweight. So if we could implement these access to healthy foods, that would in turn lower the risk of developing cancer. So here I have early detection examples. For a systems approach, you could implement you could increase the number of primary care providers that use evidence-based approaches. So they could use physician recommendations for screenings, client reminders, or chart reviews to identify patients that are for the appropriate screenings. Another systems approach would be to utilize non-traditional methods such as patient navigators, community health workers, and community health representatives to educate target populations, which I think that there's quite a bit of this already going on right now. And then another systems or policy change that we could do would allow individuals at the work site work time release so that they could go and get their cancer screening services. And another example of this would be having like a mobile mammography unit, or having a hospital facility open after hours for people who do work during the day so that they can get in after hours to get those screenings. And then another example of a systems change would be to encourage healthcare systems to monitor the adherence to cancer guidelines. This would be implementing some kind of electronic medical record systems, some kind of, I don't know the right word, but a module in which you could get these readings from your EMR systems. So some examples of treatment and survivorship that we could incorporate would be at a systems level, we could utilize our patient navigators, community health workers, or representatives. And this would in turn increase the access to treatment for our cancer patients. They could increase access by helping cancer individuals find resources if they need financial resources, reminding them of appointments, getting them to their appointments on time, things like that. And then another one that's a little bit further out there is a policy change. And this would be some kind of legislative option to expand the access to and payment for palliative and hospice care. So I just want to, now that I've told you about some of the different PSE changes that you could implement within your community, I want to remind everyone of the importance of partnerships. This work cannot be accomplished without partnerships. Various research shows the importance of public and private partnerships for policy change success. Embedding targeted policy and environmental changes in broader community initiatives whenever possible, and always continually and consistently engaging and interacting with a broader community. By bridging partnerships through PSE, you can support long-term solutions. You can help address the triggers for harmful coping behaviors, establish coalitions of partners that identify key issues in your communities, and you can create strong and self-sufficient Native American communities. So here's a list of some traditional and non-traditional partners that could help with PSE change in your community, and this could include elected officials, school districts, state and national agencies, local public health agencies and healthcare providers, local governmental agencies, coalitions that may already exist, task forces that may exist through these coalitions, community organizations, nonprofit organizations, and private interests and or companies such as the media. So as a partner, if you are helping with PSE change within your community, you need to help assist with assessments. You need to be willing to implement strategies within your own settings to create an example for other community members. You need to be advocates. So this would involve hosting forums, holding meetings, providing information to community leaders. Another good way to really get the word out is to provide media coverage so that your community can see what's going on, know what's going on. And finally, you need to promote the benefits of what PSE change is, and that's eventually and hopefully creating a much healthier community for our tribal members to live in. So just a couple take-home points. If we can focus on adapting different policy systems and environmental changes, we can maximize our resources by extending the impact and thus reaching more people. And if we can modify these environments, we can support healthy choices across the entire population rather than just on an individual level. Okay. So that's all I have for you today. I also have this. This is just a link with different guides to PSE information, toolkits, different things other states are doing, different things other communities are doing. Yeah, so thank you. Are there any questions?
I got a question, Kendra.
Okay.
Since your arrival at Great Plains, in what ways have you utilized a PSE approach assistance to reduce the cancer and the burden of cancer in communities?
Sure. So within our program, we do a lot of health education and a lot of TA to our tribal members. Specifically, we do tobacco cessation trainings, and during those trainings, we provide PSE technical assistance with them. In that way, we're not implementing the PSE, but we are giving our tribal members all of the information and resources that they would need to implement these things. We've also discussed implementing other trainings within IHS facilities that could help with cancer patients, such as caregiver trainings and addressing survivorship issues. Let's see what else. Besides that, we do give out community subawards, and within our subawards, we all 5 of our subawards implement PSE in a certain way, and a majority of them provide health education on screening and prevention efforts. So they are all mostly primary prevention focused.
Thank you, Kendra.
Mm-hmm.
Hi, my name is Tasha Peltier. I just have a quick question about your the sub-awards that you guys give out. So when on the application, it usually asks that you implement a PSE, and you explain that in your application. Do you guys provide any kind of assistance to tribes that are filling out those applications, or that are maybe looking or not familiar with PSEs and kind of want some ideas?
Yes, absolutely. We want to provide you guys with any type of information or resources that we can. So if you have questions on your application, we would be more than happy to help. We would like that you guys come up with your activity or your program you want to implement, but we could certainly help with ideas and get the process going.
Yeah, that would be awesome. I actually work for a quality improvement organization that covers North Dakota, South Dakota, Nebraska, and Kansas. And so we often find that when we work with tribal communities, we try to help them find resources. And one of our projects that we work on is a colorectal cancer screening project. We're doing some flu fit stuff right now. And so I think if we can encourage our tribal partners to apply for these sub-awards and learn more about the PSE approaches, and that'll just help us all kind of achieve what our overall goal in improving cancer rates in our tribal communities. So it's good to know that they have other people. So should we direct them to you, or is there a specific?
Yes, you would either get in touch with myself or my supervisor, Tori Whipple, who's the program manager. But yes, that would come through us, and we could set something up, a call or something where we could discuss whatever it is that you may need help on or determining. Yeah.
Awesome. So I can just guide them your way. I think, and we've been in contact with Tori before too. So
yeah, and my email actually changed. So I'll make sure that everyone has that information with my new email address. So.
Okay. Thanks.
Yep. Thank you.
And I can be sending out that information as well to Kendra's new email, and as well as the PowerPoint if anyone is interested. Kendra, we can have you send the PowerPoint to me, and I can forward that out to anyone that would like a copy of that.
Sure, absolutely.
Also, we do have a question. Kendra, what is the most common PSE change you have experienced in the work you are doing?
I would say we do a majority of primary prevention efforts, which is a lot of health education, educating about the different screenings that are out there, changing behaviors, incorporating more healthy behaviors, because that's a huge risk factor in developing cancer. And those things are all, I wouldn't say easy changes, but there are changes that don't require as much, maybe on a larger aspect, it's more of an individual change. But I would say working in primary prevention, so making sure everyone knows about their screenings, what's available, because if we can get them in to get their screenings, whether that's before the cancer has even started, they're, no cancer yet, or early detection, which then there's a much higher survival rate getting in earlier.
Thank you, Kendra. I also heard you mention something about having TA for tribal members.
Yes.
And tribal communities. Is there any way that they could access anything, like if there's anything with PSE fact sheets?
Right now, we don't have a PSE fact sheet. We do have our presentation, which we present when we go out in the communities. But if that's something of need, I think that would be something we could develop and send to our partners. We also have, because we're funded through the CDC, there is a CDC toolkit to PSE change as well, which is on the CDC website. and it's a large packet that has basically everything you would need to know.
Thank you, Kendra.
Mhm.
We'll open this up maybe a minute for any more questions. If anyone has any more questions, feel free to ask Kendra. But if not, thank you, Kendra. That was a really awesome presentation.
Thank you. Thanks for having me.
Absolutely. Also, if everyone can click on the link to the SurveyMonkey and get and fill out the feedback form, this will also help ensure that we do a better job with the webinars and anything in the future that you'd like to see. So please feel free to fill that out and contact me or anyone here at Great Plains, or even with Kendra. And we'll be sending out that information as well to Kendra's contact information and the PowerPoint. Also, we'll be sending out a link for the recording of the presentation. So if you'd like that, please let me know. Thank you, everyone, for joining us.